Let's talk about hysterectomy. So you've had a chance to sit down and talk to your doctor about your heavy or abnormal periods. You've had some evaluation and maybe testing, and you have determined that hysterectomy is the right choice for you. If you've decided on hysterectomy, there's a few things for you to know about this surgery. To begin with, this is a big surgery, and it involves removal of several organs in your pelvis, your uterus, and the cervix, which is attached to your uterus. Most of the time, the fallopian tubes, which are the little tubes that collect eggs from your ovaries and carry them to your uterus, as those are also part of the uterus and cervix. You may or may not also be talking to your doctor about removal of your ovaries. But the good news for you is that the ovaries are separate from the uterus, and so you may or may not need to or want to have your ovaries out at the same time. This is an important detail because this changes how you recover from your surgery. For some people, removal of the ovaries may mean that you're offered some hormone support after surgery to help with hot flashes or other symptoms that can happen when you have your ovaries removed. But we try hard most of the time to keep ovaries in place because we know that your ovaries do provide you with a great deal of health benefits throughout your entire life. Hysterectomy as a surgery itself is the most invasive option that we have for management of heavy and painful periods. The surgery can be done several different ways, and you as an individual with your doctor will decide which is the best surgery route to take for your hysterectomy. Sometimes we do hysterectomies through the vagina. That's called a vaginal hysterectomy. Sometimes we do the hysterectomy laparoscopically or with a camera into your abdomen and using long, small instruments. So we would use little incisions to do your hysterectomy. Sometimes you do need a bigger incision for your hysterectomy. Preparation for a hysterectomy will involve talking with your doctor and going through an informed consent so that you understand the process of the surgery, the risks, the benefits, and all of the alternatives that you have discussed already. Hysterectomy surgery can be quite complicated, though sometimes patients can go home the same day. So depending on your type of surgery, you may be able to go home the same day of your surgery, and you may stay overnight in the hospital a day or two. After your surgery, you will have a few weeks of recovery. And oftentimes I tell patients the biggest recovery is feeling fatigue and tired. After your surgery, you may go home the same day, or you may stay a night or two in the hospital. Reasons to stay in the hospital would be for pain control and making sure that you haven't had a complication of your surgery. When you go home, it will be important to have good nutrition and stay active and allow yourself to feel tired and rest as much as possible. There are some variations in how long you need to be off of work after a hysterectomy, but generally my patients are off for about 4 to 6 weeks, depending on what you do for work. So if you've decided hysterectomy is something that interests you to manage your heavy and painful periods, please come talk to us. We'd be happy to help you.